Dental Management of Bleeding Disorder by Fatima Aziz, Part 2. Detection of bleeder patient. History, bleeding problem in relative, bleeding problems after operation or teeth extraction, bleeding after bleeding problems, trauma or cutting wound, medication causing bleeding problems, aspirin, anticoagulant drugs, long-term or anticoagulant, certain herbal preparation, presence of disease, leukemia, liver disease, hemophilia. Clinical examination, jaundice, pallor, spider angioma, oral ulcer, hemarthrosis. Number 3, screening laboratory test, prothrombin time, partial thromboplastin time, and platelet count. Number 4, surgical procedure, excessive bleeding after surgery may be first sign. Dental management of hemophilia. Difficulties in the management of hemophilic dental patients include the following. Number 1, dental neglect necessitating frequent extraction, trauma and surgery. Factor 8 inhibitors, recombinant factor 7A is an alternative solution. Number 4, hazard of anesthesia and injection. Number 5, risk of hepatitis B and liver disease and HIV infection. Number 6, aggravation of bleeding by drugs. Number 7, anxiety and drug dependence. A preoperative consult to hematologist to confirm the diagnosis, severity of disease, mild to moderate form, usually treated in dental clinic. Severe cases treated in the hospital, replacement of factor 8 1 hour before procedure. Use the gel foam with thrombin to control bleeding. Supplement for patient with multiple extraction. Post-operative in dental clinic, patient need second dose of factor 8. Hospitalized patient will need additional dose of factor replacement. It also should check for sign of allergy. Avoid use of aspirin or non-steroidal anti-inflammatory drugs. The bleeding tendency can be aggravated by non-steroidal anti-inflammatory drugs. Safer alternatives for pain control are acetaminophen, codeine, and COX-2 inhibitors. Local anesthetic regional blocks, lingual infiltration or injection into the floor of the mouth must not be used in the absence of factor 8 replacement because of the risk of hemorrhage hazarding the airway and being life-threatening. If factor 8 replacement therapy has been given, regional local anesthesia can be used provided the factor 8 level is maintained above 30%. Infiltration, intraligamentary, intraosseous, or intrapulpal injection are still safer. Post-extraction hemorrhagic. Contact the hemophilia unit and consider using additional factor concentrate. Inspect the site of bleed. If there is any evidence of tear in the gingiva or other obvious bleeding point, this should be treated using local measures. Instruct the patient to sit up and bite on a damp gauze swab for at least 10 minutes. Use a 10% solution of tranexamic acid or EACA to dampen the swab or as a mouthwash if the bleeding is difficult to stop. Monitor the patient's blood pressure as it may increase due to worry and pain. Dental management of one-wall brand. Mild form surgical procedure can be done in the dental clinic without use of demobrasion and EACA, E-aminocaproic acid, or tranexamic acid, cyclocapron. More severe require factor 8 construction. Dental management. Establish for good or hygiene, platelet supplement, treatment of acute infection. Post-operative patients should examine 24 to 48 hours for bleeding. If the bleeding present, give the patient tranexamic acid and EACA. Anticoagulants divide into rapidly acting اللي هي parenteral, slow acting oral. Rapidly acting heparin and indirect factor 10A inhibitors. Slow acting divide into warfarin and endione derivative and direct thrombin inhibitors. Acquired bleeding disorder. The main cause include these are given as prophylaxis or treatment of thromboembolic events. They are used to treat arterial fibrillation, IHD, MI, DVT, CVA, and pulmonary embolism. The common anticoagulant drugs are warfarin for long-term treatment or heparin for short-term treatment. Anticoagulants are given to people to stop thrombosis, blood clotting inappropriately in the blood vessels. This is useful in primary and secondary prevention of deep vein thrombosis, pulmonary embolism, myocardial infarction, and stroke in those who are predisposed. Heparin. Heparin is a biological substance usually made from pig intestines. It works by activating antithrombin 3, which block thrombin from clotting blood. It also used as a parenteral anticoagulant, given subcutaneously or intravenously for acute thromboembolic episodes and for hospitalization protocol that includes significant surgical procedure to prevent the DVT and pulmonary embolism. Heparin acts immediately on blood coagulation to block conversion of fibrinogen to fibrin. Protamine sulfate acts as reverse effect to heparin. The PT and PTT are prolonged most patients with the PTT. Warfarin block a vitamin K dependent step in clotting factor production. It impairs coagulation by preventing synthesis of factor 2 prothrombin 7, 9, and 10. Resolution of warfarin effect is determined by measurement of the prothrombin time, which is standardized across institutions using an international normalized ratio, PT and INR. Scurvy, vitamin C deficiency affects the normal synthesis of collagen and results in a bleeding disorder characterized by petechial bleeding, bruising, and subperiosteal bleeding. The key to diagnosis is the dietary history. Screening test. Number 1. Bleeding count. The normal is 100,000 to 400,000. Lower than 100,000 thrombocytopenia. From 50,000 to 100,000 mild thrombocytopenia. Lower than 50,000 severe thrombocytopenia. Low platelet count, aplastic anemia, a vitamin B12 deficiency, iron. Low platelet count, aplastic anemia, a vitamin B12 deficiency, iron deficiency, viral infection including HIV, Epstein-Barr virus, and chicken pox. Exposure to chemotherapy, radiation, or toxic chemicals. Consuming too much alcohol or alcohol toxicity, ethanol abuse, leukemia, autoimmune disorder, pregnancy, viral, bacterial, and bacterial infection, antiplatelet antibodies. High platelet counts, cancer, most commonly lung, gastrointestinal, ovarian, breast, or lymphoma, anemia, in particular iron deficiency anemia and hemolytic anemia, inflammatory conditions such as inflammatory bowel disease or rheumatoid arthritis, infectious disease such as tuberculosis, recovery from significant blood loss such as from trauma or major surgery, after physical activity or exertion, recovery from excess alcohol consumption and vitamin B12 and folate deficiency, diabetes mellitus, increased blood lipid or cholesterol level, increased platelet levels, and smoking, rheumatoid arthritis, renal failure, chronic pancreatic. Bleeding time. Prothrombin time measure effectiveness of the extrinsic pathway. Normal value from 10 to 15 seconds. Bleeding time. Prolonged bleeding time may be result from decreased number of thrombocytes or impaired blood vessel. Bleeding time is affected by platelet function, certain vascular disorders, and von Willebrand disease, not by other coagulation factor. Diseases that cause prolonged bleeding time include thrombocytopenia, disseminated intravascular coagulation. Diseases that cause prolonged bleeding time include thrombocytopenia, disseminated intravascular coagulation. Aspirin and other cyclooxygenase inhibitor can prolong bleeding time significantly. People with von Willebrand disease usually experience increased bleeding time. Von Willebrand factor is a platelet agglutination protein, but this is not considered an effective diagnostic test for this condition. It is also prolonged in hypofibrinogenemia. Many experts regard the bleeding time as useless in that it doesn't predict surgical bleeding. Role in post-myocardial infarction patients. Partial thromboplastin time measure effectiveness of the intrinsic pathway. Normal value 25 to 40 seconds. Thrombin time for thrombin to convert fibrinogen to fibrin, a measure of fibrinolytic pathway. The normal value 9 to 13 seconds. Prolonged prothrombin time and partial thromboplastin time leading to vitamin K deficiency, liver disease, acquired inhibitor to factor 5, factor 10 deficiency, DIC. Management of bleeding in patients with uncontrolled hypertension. This group of patients need appropriate medical consultation for initiation of medical treatment to decrease their blood pressure. Thus, once their blood pressure is controlled, then the bleeding decreases, and with local measure the hemorrhage is controlled. Thank you.